Yeah, I'm going to do it like you, man. We're going to talk about COVID-19 and multiple sclerosis, and we're going to have that conversation right now. What's going on, y'all? It's Damian Washington here with MS Views and News, MS Views Now. We're here to mitigate some of the feelings of loneliness and isolation that come along with multiple sclerosis. And right here, you know there's only nothing but the most illustrious guest on this program. I have Dr. Aaron Boster of the Boster Center for Multiple Sclerosis in Ohio.
Damian, thank you very much for including me today. My name is Aaron Boster, and as always, thank you for learning about MS with me. I want to thank MS Views and News for the opportunity to raise our level of understanding, to help educate, energize, and empower people impacted by MS. It's a time right now when a lot of people are scared. It's a time right now when we need good, solid information. We need to remind ourselves that we are a global online community here supporting one another. And I'm looking forward to the next couple minutes when we can break down what's going on with COVID-19, this novel coronavirus, and what active things you and I can do to stay healthy and keep our community safe. So let's dig into that conversation, and I appreciate this opportunity. If we break it down, let's talk about viruses. So when we think about the flu, what we're actually talking about is influenza. And influenza A is a virus that impacts the whole world during the winter months. It can be quite serious. It takes lives every year. And when you talk about getting a flu shot or a flu vaccine, you're typically talking about taking strains of last year's influenza virus. But influenza is not the only kind of virus that can give us a cold. In fact, there's an entire other family of viruses called the coronavirus family. And the coronavirus family is made up of hundreds and hundreds of coronaviruses. These are largely RNA viruses, and they can cause humans to have a common cold. Some of the viruses impact humans and can cause us to feel sniffly and yucky and febrile, etc. Other types of coronaviruses don't affect humans, they only infect animals. And so there are animal-specific coronaviruses. Now, what's unfortunately happened in the world today is that one of these animal coronaviruses, and we believe it's a coronavirus from a bat, jumped species and figured out a way to infect human beings. And our bodies, our immune systems evolutionarily are not used to this novel coronavirus, and it's causing quite a pandemic across the world right now. So we've coined novel coronavirus 19. It's a new coronavirus that we're not used to seeing. It was
essentially, we all have a bat cold right now. Is that what it is?
Kind of, in a weird way. The idea is that a coronavirus that really only infected bats jumped species and now is infecting humans. We first saw this several months back in Wuhan, China, and it has now spread and become a global pandemic. And it's got a lot of people very appropriately concerned. So what I would like to do is kind of talk a little bit about what the virus is, the way it presents, and then get into risk factors to increase the risk of catching the virus, increase the risk of having a severe infection if you have the virus, and most importantly, what we can do to fight back to protect ourselves. So Let's have that conversation.
Let's just go into it. Talk to me about how I can prevent myself from catching the bat cold.
There you go. There you go. So first, some knowledge about what novel coronavirus is, what COVID-19 is, how it presents. And so what we're seeing, the most common symptoms of people that catch coronavirus is fever, cough, and shortness of breath, just like most other viruses. And in fact, 80% of people who contract coronavirus, they're going to present with a mild cold. It's not going to necessarily feel any different than any other cold, and they're going to clear it. Typically, there's an incubation period, a delay between 2 and 14 days from when you contract the virus to when you manifest symptoms. And it's important to note that even when you're asymptomatic, meaning I've come in contact with a virus, I now have the virus, but I don't even know it yet, I'm not manifesting symptoms, I'm not febrile, I'm not coughing, I'm not short of breath, I can still pass the virus on during that incubation period. And so that's an important thing that we need to keep in mind. This virus is not spread, we don't believe, by respiratory droplets, like, it spews in the air, as much as viral particles being coughed out or sneezed out and then adhering to surfaces. And then we touch those surfaces with our hands, and then we touch our face and we get ourselves infected that way. And that's actually very relevant as we game out how we're going to prevent ourselves from coming in contact with this virus. Now, I mentioned that about 80% of people that are impacted have a mild cold and then they clear it. About 15% of people are going to have a more serious condition and they're probably going to need medical assistance. And somewhere around 5% of folks are going to need intensive care. Now, the mortality of this virus is higher than that of what we're familiar with influenza. And that's obviously very, very serious. And we've identified certain risk factors which predispose a given human to have a risk of more serious infection. So it has nothing to do with whether or not you could catch the virus, but if you catch the virus, certain risk factors make that a more serious infection for you. And so what are those things? Number one, age. So being under 9 years of age or being over 60 is an independent risk factor for more severe disease. That doesn't mean if you're 62, woe is me, doomsday. It simply means that you're in a higher category of risk. And each decade that you go up past 60, the risk seems to skyrocket. So 70-year-olds are going to be at increased risk compared to 60-year-olds, and 80-year-olds, the mortality associated is actually quite higher. And so that's one factor, is age. The second factor is comorbid conditions. So if you have a heart condition, a lung condition, if you have a diabetes, if you are immunocompromised from a cancer, or if you have low white blood cells from a therapy, and we're going to be talking about some of those, this would increase a given individual's risk not to catch the virus, but if they catch the virus, to have a more severe form of the infection. And so that's another piece of important information that we want to keep in mind as we game this out. Now, another factor that I think that we must consider is geography. So right now, we're having a conversation. I'm in sunny Columbus, Ohio. You're out in Southern California. And these are very different parts of the United States with different degrees of concern geographically. We have not seen as much coronavirus in the Midwest as we have on the coasts, for example. And if we were having this conversation in Italy or in Japan or in Korea or in China, we would have very different recommendations than we would if we're talking in LA or in Ohio. And so I also want us to keep in mind geography as an important factor. Another factor that I think we have to keep in mind is occupation and vocation. If you are a stewardess on an airplane flying around, or if you are working in a hospital and coming in contact with a lot of people that are ill, your risk profile may be a bit higher than if you work on your computer in your basement. And so that's another factor that I think that we have to keep in mind. Now, I want to jump in specifically and talk a bit about MS. You and I are both members of this larger MS community, and there's a lot of concern. In fact, in the popular press, I'm getting a little bit frustrated with the message, don't worry, it's only a problem for the elderly and the ill, which frankly is rather disrespectful.
Yeah, I'm not elderly, but I'm ill.
Well,
That's everyone else who's watching this. They might be elderly, and they might be elderly and they're ill,
yeah.
but they're certainly ill.
And so, what we need to do is we need to put that aside and we need to ask ourselves instead, what can we do to help our communities? Because every single person listening to this can play a very active role in helping the community not contract coronavirus. We're going to list active things that you need to be doing, that I need to be doing to help each other out. So let's talk about that for a second after I have a sip of coffee.
Oh, you got your awesome juice, and so do I.
Get you in. So let's talk a little bit about multiple sclerosis and this COVID-19. Having multiple sclerosis in and of itself is not a risk factor for contracting COVID-19.
Oh,
Having MS by itself is not a risk factor for having a more severe infection if you contract COVID-19. With the caveat, Damien, that if you have advanced multiple sclerosis and you're seriously affected where you can't take deep breaths, you can't cough adequately, you're not able to move, that would place you at increased risk of severe infection. So I do want to throw out that caveat.
Okay.
Now, whereas MS in and of itself doesn't increase the risk to contract COVID-19, and it doesn't increase the risk of having severe disease, some, not all, some of the MS medicines that we give people to combat the disease, I'm talking about the disease modifying therapies, can increase the risk because they suppress the immune response. And so I kind of want to walk through with you the different MS medicines with the lenses of, does it increase or decrease the risk of a severe infection for COVID-19? So let's jump
Please do,
to that.
because some of us are on Copaxone, some of us are on Lemtrada. I'm on Ocrevus.
Exactly.
There are a range of various medications that have different mechanisms within the body to combat the multiple sclerosis either attacks or relapses as well. So
That is
these
exactly
are
right.
all very concerning because everyone is on a host of different medicines, at least like 16 different medicines, something like that.
That's exactly right. So let's break it down at a relatively high level. Number one, if you're taking an injection, all right, so if you're taking an interferon beta product like Plegridy, Avonex, Betaseron, Extavia, Rebif, or a Copaxone injection, we do not consider you to be at significant increased risk. Those medicines do not suppress the immune response. They don't lower the white blood cell count. They work by modulating the immune response. And if you're a person with MS and you're taking an injection, I do not think that injection increases the risk to have severe infection if you come in contact with COVID-19.
Well, thank you, immunomodulators. Thank you.
Yeah. Now, if we to talk about pills, all pills are not made equally. There's a bunch of pills on the market and they all work differently. Aubagio, which is the trade name for teriflunomide, is a once-a-day pill for MS. It also does not lower the white count significantly. It works by what a doctor term cytostatic. So it makes cells play the freeze game, but it doesn't murder them. And we don't feel that putting someone on teriflunomide Aubagio would increase the risk to fight the infection. Now, as a sidebar caveat, the doctor nerd in me, I think it's fascinating that teriflunomide actually has antiviral properties. And so hypothetically, there may actually be a benefit, but that's conjecture. We don't actually know that. I just think that's like kind of interesting. The punchline here is, just like with the shots, if you're taking Aubagio, I'm not terribly worried about your ability to fight the infection. Now, I can't say that those are the rules for all of the pills. The next pills I like to talk about are the fumaric esters. So this is Tecfidera, yep, and Vumerity. So Tecfidera, which is dimethyl fumarate, and Vumerity, which is thyroxymethyl fumarate, are both pills that you take twice a day for MS, and they are not supposed to work by suppressing the white blood cells. That's not how they're supposed to work. In about 15 to maybe 20% of patients that take Tecfidera Vumerity, there's a side effect where it lowers their white blood cell count. And if the person with MS on Tecfidera Vumerity has a lowered white count as a side effect, then they might be at increased risk of a severe infection if they were to contract COVID-19. So how do you know if you with MS taking Tecfidera are at risk? You got to holler at your doctor, because they're going to have your laboratories and they're going to be able to look at your white blood cell count and your absolute lymphocyte count, or your ALC. And the absolute lymphocyte count is the subset of the white blood cells that we're really focused on. Ideally, we want that number to be above 0.8. So if you're taking Tecfidera and your absolute lymphocyte count is above 0.8, I'm not very concerned about your ability to fight off COVID-19. If, however, you're on Tecfidera and your absolute lymphocyte count is below 0.8, then I think that you might be in a slight increased category of risk. And so with Tecfidera and Vumerity, there's a level of granularity that we have to get into. We have to look at your labs to be able to adequately counsel about what to do or what not to do. Now, the next pill I want to talk about, or two pills that I want to talk about, are the S1P1 receptor modulators. That's a mouthful. We're talking about, we're talking about Gilenya and we're talking about Mayzent. So those are trade names for fingolimod and siponimod. And
We're
these are
talking about Mason and who again?
Gilenya.
Mason and
So
Gilenya. Got
yeah, those two medicines are in the same class, and they work by moving the white blood cells into the lymph nodes. Not all of them, but most of them. And we know that in these clinical trials that people were at slight increased risk of having upper respiratory tract infections compared to placebo or other medicines when they took these medicines. These medicines don't work by killing white blood cells, but by taking them out of circulation. There's what I refer to as a functional immunosuppression. So there is a slight increased risk, I believe, for people taking Gilenya as compared to if they weren't on it at all, that they would have trouble fighting the infection. And
it.
that's a bit of conjecture because the reality is we don't actually know, but that's based on the mechanism of action and how we think the medicine works. Now, I'm going to say this once now, and I'll say it at the end, but the worst thing that I think that you could do is become nervous and just cold turkey stop your MS medicine. And in specific with Gilenya, as well as with Tysabri, there's a risk of a rebound phenomenon. So if you're taking Gilenya, the message is not stop taking it. No, the message is you're going to want to talk to your healthcare provider about whether the best course of action is to continue or to do something different. All right, and that's actually a really important point, Damien. We don't want people inappropriately stopping medicines out of fear because they might make their situation much, much worse.
Yeah,
Now,
don't stop it all cold turkey because you
that would
scared of
be
the bat flu, you know?
not so good for you. Now, to
Nah.
finish our conversation about pills, one of the newer pills to join the market is a medicine, cladribine, or the trade name in the United States is Mavenclad. And cladribine is an immunosuppressant. It reboots the immune response. You take a pill a day for 5 days, and then the next month you take 5 days, and then you don't do anything for a year, and then you repeat 5 days, wait a month, 5 days. Then you're good for the next several years. The way this medicine works is it suppresses the white blood cells, the B and the T cells, and lets them come back up. And so when you take this medicine, the risk for fighting infection has everything to do with timing. If you just took Mavenclad, you're going to suppress your immune response temporarily, and you're going to be at an increased risk of severe infection if you contract COVID-19. If you're looking 3 years past your last dose of Mavenclad, then you've reconstituted your immune response, and we don't think that you're going to be in harm's way. So the answer has everything to do with the timing. How long ago did you take Mavenclad, and how have your cells come back? Now, fortunately, with a very simple blood draw, we can check and we can look at your white blood cells. We can look at, again, your absolute lymphocyte count. And so we can guide you, yes, you're at increased risk. No, you're not at increased risk. So if you've taken Mavenclad, you can't untake it. All right. So once you set that in motion, it's set in motion. And that's okay. Knowing that you might be in a period of risk, we can take behaviors to help protect yourself. If you are just about ready to start Mavenclad, it's probably appropriate to talk to your local healthcare provider about your other risk factors, the geography of where you're living, how serious your MS is, and you're going to do a risk benefit about whether you pull the trigger or whether you delay starting therapy. And again, that's a conversation that you have to have with your healthcare provider. There are scenarios where the risk of contracting COVID might be low, and the risk of leaving your MS untreated is very high and concerning. And the better part of valor might be to take the pill, or the better part of valor might be to wait a month or two. And so that's a conversation that you're going to have with your healthcare provider. Now, we've talked about shots, we've talked about pills. I want to transition into infusions. And as it turns out, 3 of the most effective MS medicines on the market are all IV infusions taken through the vein.
Right. I'm on Ocrevus, and I know that's one of the big guns, and a big guns in the infusion category, and there are a couple others too. So please speak on that.
For certain. So of the 3 infusions, and I'm talking about Tysabri, which is the trade name for natalizumab, I'm talking about Ocrevus, the trade name for ocrelizumab, and alemtuzumab, that's Lemtrada. Of those 3 medicines, I think the lowest risk of the 3 is Tysabri. So Tysabri is a monthly infusion, and Tysabri makes the blood-brain barrier the Great Wall of China. All right, so it doesn't lower the peripheral immune response. It lowers the immune response in the brain.
Yeah.
So the periphery, the bloodstream, the lymph nodes, that part of your immune system is normal. And if you were to contract COVID-19, if you came in contact with it, your immune system would just beat it up. If, however, the virus got into the brain does not have normal immunosurveillance. It doesn't have a normal immune response, and that could be very serious. That being said, I think that of the 3 infusions, Tysabri, quite frankly, might be the least concerning. And again, we do not want to cold turkey stop Tysabri because of a concern for a rebound phenomenon where the MS comes back with a vengeance. And so if you're taking Tysabri and you have concerns about COVID-19, you want to holler at your provider to discuss the region you live in, other risk factors, and whether the better part of valor is to keep on keeping on, or if there needs to be a mitigating strategy. And that's going to be determined literally on a case-by-case basis for each person impacted by MS on Tysabri. Now, 2 more medicines that I want to discuss with you before we open it up to community questions. That next medicine is ocrelizumab, Ocrevus, the medicine, Damien, that you said you're taking. And Ocrevus is an infusion in the vein twice a year. It works by knocking down a sliver of the immune response. So it's not a pan immunosuppressant. So it's not like napalm and you burn the place to the ground. It's selectively knocking out adult B cells. And that's relevant because when you need to fight a virus, you fight the virus with T cells. And ocrelizumab doesn't lower the T cells, it just lowers the B cells. And so if you're taking ocrelizumab, I do believe that you're at slight increased risk of having a more severe infection, but it may not be as bad as we would think with a classic immunosuppressant because we're only impacting the B cells. Now, Ocrevus is taken every 6 months, and there's a re-up. You take it 6 months later, you re-up. 6 months later, you take it again. And if you've been taking ocrelizumab and it's getting close to the time to redose, I think that's a conversation for your provider. Many people here in Ohio, I'm recommending they go ahead and take their medicine because we didn't put them on it casually. We put them on it to prevent MS from attacking their holiest of holies, the supercomputer, the brain. And we need that. But you can imagine in an area where there's higher concern geographically, or if a given individual has other risk factors, maybe comorbid conditions, or they're say in their 70s or something, you might delay the next infusion. Again, I think that's a critically important conversation that you have with your provider to figure out what makes the most sense for you. And really, you're going to be deciding, do we pull the trigger at 6 months, or do we need to wait a month or two? You have signed up to start ocrelizumab, I really think it's the same conversation. Do we go ahead and start because the risk benefit favors treating the MS, or given that this is a mild form of immunosuppression, do we need to wait? Now, the last medicine that I want to discuss is arguably one of the most effective medicines. It's called Lemtrada or alemtuzumab, and it works, again, it's an IV infusion, and it suppresses both the adult B and T cells, and it does that for a prolonged period of time. After you take Lemtrada, it's going to take you the better part of a year to reconstitute your immune response. And you take 5 days in a row, and then a year later, you take 3 days, and you're going to knock down your immune system again. And so when you're thinking about risk of severe infection with COVID-19, and as it relates to Lemtrada, just like with cladribine, it's all about timing. If you had Lemtrada 3 years ago, and your absolute lymphocyte count has normalized, it's above 0.8, I ain't worried because you've reconstituted your immune response. If you had Lemtrada last week or last month or 6 months ago, or even within those first 2 years, you still might have a suppressed immune response. And so you may be at an increased risk category to have a severe infection if you contracted the virus. And so it's all about the timing. If you're someone that took the first dose and you're getting ready to take the second dose, I think that it's incumbent upon us to have a very serious conversation about, is this the right maneuver, or do we need to wait, or do we need to think about a different option? And in order to make that decision for the individual, we're going to have to weigh what is their risk, where do they work, where do they travel, do they have comorbid conditions, et cetera, et cetera. To be complete, Damien, we should also mention that stem cell transplantation, which is something that is done in the United States only in the context of research, but in other countries around the world is available. This is probably the highest category of risk. Ablating the immune response so that you don't have one puts you at the highest risk if you contract the infection. So I just want to kind of run through with you my thoughts or my opinions as it relates to risk of severe infection as in the disease modifying therapies. And
Yeah, no,
before we
this is huge. I want to blanket this or bullet this point where it's like, okay, if you have MS, yes, you have a compromised immune system, especially when you add one of these therapies on. How and it's dependent on your comorbidities and where you are located in the world, and yeah, what kind of medication you're it's taking.
and
Also,
your age.
this is risk. This is risk management. We're not saying that because you have MS, you're going to catch the disease, or
Yeah,
you have MS and you're on a certain disease modifying therapy, you're going to catch the disease. No one
you're
is saying that, and
you're
to be
exactly right.
worried about that, just try to temper that. I know it's a scary time, but there are plenty of other things to be worried about. And one
And
of them, and the big thing, is managing risk. And you know
that's right.
about managing risk, and you've spoken about that. Please help us out with that. How do we
Well,
manage this risk when our immune systems are so tender, sir?
and that's the really the take home of this conversation, I hope, is that there are active things that we can do to lower our risk. To summarize what we just talked about, having MS doesn't lower your immune response. In fact, people with MS have an excessively exaggerated immune response. And so
It's a big
people with
extra.
MS in and of itself aren't at increased risk of contracting the infection or having trouble fighting the infection. It's the medicines that you're on, the comorbid conditions, the other medical conditions, your age and your geography that alter that risk profile. But let's get down to brass tacks and talk
Yeah,
about things that you and I can do to manage the risk. And here's the take home. If you don't ever come in contact with COVID-19, you can't get COVID-19. It's kind of like saying, if you never come in contact with HIV tainted fluids, you can't get AIDS. If you don't come in contact with a person who is infected with COVID-19, you can't get the infection. And keeping that in mind, there are certain behaviors that we want to do. We want me to do them. We want you to do them because they will help the community. What are they? Number one, wash your hands. I mean, for real, we got to wash our hands. And there's two ways to wash hands. Way number one is to use a alcohol-based disinfectant, like an alcohol solution, like
the
Purell.
hand sanitizer.
There you go. And you want the hand sanitizer to be at least 60% alcohol based. Now, let me share a pro tip with you. You can make hand sanitizer for real. If you buy isopropyl alcohol, yeah, for real. You can buy isopropyl alcohol, which is rubbing alcohol, and you can buy aloe vera, like the green aloe vera for like a sunburn, and you mix
Yeah.
that together. That is hand sanitizer. So you could make hand sanitizer at home, quite frankly. And you want to sanitize your hands or wash your hands, and I'll get into washing in a second, at certain points. Number one, you want to wash your hands if you sneeze or cough. Number two, you want to wash your hands before you eat. Number three, you want to wash your hands after you go to the bathroom. These are important times to wash your hands using hand sanitizer, disinfectant, or washing with soap and water. Now, if you have
Oh,
dirt
well,
on your
hold on one second there. And when you sneeze, don't sneeze or try not to sneeze into your hand or your sleeve.
hands,
You sneeze
no,
into
you
a
want to sneeze, you want to sneeze into a
you need
tissue.
to
And
deposit
I have
that
a
tissue in the garbage and sanitize your
I have a
hands.
prop, Damien. I have a prop. So
Okay,
I brought my own tissue as a prop.
go get
So
it.
if you're gonna sneeze or cough, do it into a Kleenex, and then take that Kleenex and throw that in the trash can. All right.
Done.
Then you need to wash your hands or use hand sanitizer afterwards. I don't want you to sneeze into your elbow because now you have virus on your sleeve. and someone could
And when
touch
you
it
get
and you
tired
touch
and
it.
you're like, then
Oh,
you
yeah,
just put the virus in your eye, bro.
that's not a good idea. So if you're going to use soap and water, all right, then you need to wash your hands for 20 seconds. Now, 20 seconds is a really, really long time. And a lot of people, when they wash their hands, if you're in like a public bathroom, they'll get their hands wet, they'll put soap on their hands, and then they'll wash the soap off and they're good in the hood. No, they're not. You need to wash for 20 seconds. And so I want you to wash from the wrist up, and I want you to scrub the webs of your fingers. I want you to scrub your wrists. And a good way to make sure that you're washing with soap and water long enough is to sing a jingle. All right. So my son recently turned 13. And so let's together practice washing hands while we sing to my son Maxwell happy birthday. Are you with me? All right,
Sure.
ready? 1, 2, 3. Happy
Happy
birthday
birthday
to
to you. Happy birthday to you. Happy birthday, dear Maxwell. Happy birthday to you.
and many more. So that's
More.
20 seconds. That's 20 seconds of washing hands, which brings up 2 points. One, I should never sing. All right.
Yeah,
Uh, number two, 20 seconds is a long time. And if you don't
yeah,
want to sing happy birthday to my son, you could sing Twinkle Twinkle, or you could sing your favorite lyrics of something else, but it needs to be 20 seconds. All right.
yeah.
So
I sing
washing,
Eminem's "Lose Yourself" chorus. There's
I
that
love
Beyonce
it.
"Crazy Love."
Fantastic.
There's
Fantastic.
"Raspberry Beret." I'm like, she wore a raspberry beret, the kind you find in a secondhand
So
store,
that's
and then
exactly
so on and
right. I
so
love it.
forth. So
Now, so
yeah,
that's the first thing is wash your hands. And I know that sounds like, advice grandma gave you, except grandma was right. All right. Because
right.
if you have virus on your hands and you sanitize your hands, then you're not going to infect yourself or somebody else. Tip number 2 is don't touch your face. Humans touch their face a couple times a minute on average. We're constantly touching our faces. And if you have virus on your hand and you touch the membrane of your eye, your nose, your mouth, that's how we're giving ourselves the virus. And so to the extent that you can, try not to monkey with your face. Try not to touch your face. And I bring that up to you because we do this without realizing it. If you watch the replay of this video, I guarantee that periodically I'm touching my face, you're touching your face. And so we just want to become more aware of it. We want to wash and sanitize, disinfect our hands, and we want to not touch our face. That's number 2. Number 3 is to wipe off surfaces that are commonly touched. So carrying some disinfectant wet wipes, like some baby wipes kind of thing, and wiping down the table before you eat, wiping down the area where you're going to be working, wiping down your phone, which is probably like a petri dish, because you're touching your face, you're dropping it on the floor, you're sticking it in your pocket. I mean, this thing probably has all kinds of germs on it.
It's great.
Wiping down the surface of your cane. These are things, and you don't need to be crazy. You don't need to like go into a room and then clean the whole room, but simply wiping down commonly touched surfaces is a really, really good idea. Again, this COVID-19 virus can live on surfaces. And so we want to disinfect those surfaces with a wet wipe before we're touching them. And that's another way to decrease one's risk. We already talked about if you're going to sneeze or cough, do it into a tissue, throw the tissue out and wash your hands. That's an important one. And there's another really, really important tip. And so if you're not listening, start listening like right now. You can socially isolate yourself. Let me explain what I'm talking about here. If you go in a crowd of 1,000 people and a couple people in that crowd have COVID-19 and they're coughing and they're sneezing, they're going to risk spreading that infection. All right. And in fact, we think that being within 6 feet of somebody with COVID-19, you can get the infection.
Mm.
So if you, on the other hand, remove yourself from that crowd, you socially isolate from that crowd, you can't get COVID-19. And so right now here in the state of Ohio, Ohio State University, which is a really big university, they have closed classes. Miami of Ohio, which is another university here in Ohio, they've closed classes for the semester. They're done for the semester. My kids who are in middle school, my kids are home from school for the next 3 weeks.
Good luck
And
with that,
yeah, thank you. um,
Doc.
the reason this is happening is because we're trying to minimize groups and crowds of people. I had plans to travel around the United States this month and next, going to Florida, going to California, going to the East Coast. I've actually canceled those plans, not
Mm.
because I, Aaron, am concerned about contracting virus and being able to clear it, but I, Aaron, as a doctor in clinic, don't want to risk contracting the virus and then sharing it with all my patients.
Look at
So,
you, a responsible medical professional. I
so
appreciate that. Thank you,
no,
Dr.
what?
Boston.
So you don't have to live in a like a hermit, all right? You don't have to like board up your doors and hide, but you can make good decisions. Don't go to a concert, all right? I would not go to an amusement park, not right now. And if you have plans to travel, particularly in an airplane, and it's not required, I don't think now is the best time to do that. If you are someone impacted by MS and you're on one of these medicines, which might place you at increased risk of getting a severe infection, you can mitigate that risk by avoiding contact. All right. And so I think by making smart decisions, you can really up your game and keep yourself safe. And you can help prevent or slow down community transmission. If you've looked on the interwebs or at social media recently, there's a lot of hashtag flatten the curve, right? And what they're talking about is if you let virus just run rampant, it'll peak and then it'll slowly get better. All right, so that's what we saw in Wuhan before they knew what they were dealing with, right? We saw this massive peak, and now it's starting to come down. And the problem with that is that peak of infected people is so high, it overwhelmed their healthcare system.
Mm.
If we as a community can minimize the spread or slow the spread, we can keep the number of infected people that need healthcare professionals lower and flatten the curve so that it's more flat and it allows us to have adequate resources.
Mm.
So staying home when you're sick, avoiding sick contacts, sneezing into a tissue, washing your hands, disinfecting surfaces, socially isolating. These are things that we can do, not just to help us, not just to help our health, but to help our neighbor, to help our community. And they're things that we really, really should be doing right now. And so
Mm.
the last thing that I want to talk about after I have a sip of coffee is masks. Chin chin.
Right, man. I've been having the coffee this whole time, just sip by sip. But
It's
I haven't been saying as much because I'm not a medical professional. I'm
oh,
just a nerd. I'm just a charismatic nerd.
do go on. So let's talk about masks. If you have COVID-19, if you're infected, right, you've been tested and you're infected, and you need to go out of your house, wear a mask. I'm not asking you to wear a mask to protect you. That's not why someone who's sick with COVID-19 should wear a mask. They should wear a mask so they don't share the virus with other people. It's it's to protect other people from you coughing and sneezing and sharing the virus. If you do not have COVID-19, wearing a mask, particularly like the kind of mask that you pick up at the pharmacy, isn't going to help you.
Mm.
Those masks don't adequately protect you. And in fact, it might actually increase the risk of infection because
Right.
the masks aren't professionally fitted and you're going to be touching your face and adjusting the mask on and off and and adjusting the straps. And the result is you end up touching your face a lot more. Now, the other thing I want to point out is when a healthcare provider is wearing a mask, those N95 masks are special. They're not normal masks. You can't pick one up at the pharmacy, and they're fitted to your face. I remember when I was coming up through the ranks in medical training, about once a year, we'd have to go to this little room in the basement, and some dude is there, and he would fit us with the mask, and he'd fit it on our face, and then he would open up these chemicals and see if we could smell them through the mask. And if you could, then they would have to refit the mask. They even had to shave beards sometimes to get that bad boy to fit properly.
Oh
And so
wow.
those masks are not commercially available. And so the take home is if you don't have an infection, wearing a mask is probably not going to help you. And
Mm.
and I want to share that because I think to not understand that you could actually increase your risk by throwing on a faulty mask. So,
Right, because the virus gets on the mask, and then you're
and then
touching the mask.
exactly. Don't touch your face.
Ugh.
So I appreciate, Damien, the opportunity to discuss COVID-19, what it is, what are the symptoms, who might be at increased risk as it relates to general risk factors, as it relates to MS risk factors. But most importantly, I really appreciate the opportunity to share with you things that you and I can do to keep us safe. And with that, if
Absolutely.
there are some community questions, let's jump into them and knock them out.
Yeah, let's do it. No, I appreciate how you have already on your channel and this channel worked to explain very plainly the risk factors involved and what someone with MS has to think about
Yep,
and be in their best health going forward. So I appreciate that. Thank you.
right on.
A lot of these community questions, there's a lot of overlap in them, and I'm
Okay.
going to try to rapid fire through them as many ways as I can because, like I said, we've discussed a lot of this stuff already. However, I want to honor the question. So if it's like, hey, is the MS immune system impacted more by coronavirus? Dr. Boster would be like, no. Next question.
Yeah, exactly right. That's exactly right. People with
So,
MS have an exaggerated, overly active immune response.
yeah, exactly. This person, his question is it possible the immune system has already become strong enough so that I'm no longer part of the vulnerable community at great risk to contract the coronavirus?
Without information, it's very hard to say.
Yeah,
If you are not over 60 or under 9, if you have no other comorbid conditions and you're not taking an MS medicine that lowers your white count, you're probably not at increased risk compared to the general population of having a severe infection.
and speaking of that, someone says, hey, if I take Gilenya, am I at increased risk of catching coronavirus? No.
No. So you're not at increased risk to catching the virus. All right. The risk of catching the virus is being around people that are infected, about having virus on your hands and touching your face. And so whether it's Gilenya or another drug or no drug, you can mitigate the risk of catching the virus by doing those things, by socially isolating, by not touching your face, by sneezing into a Kleenex and washing your hands, etc.
Great. No, so here's another one. I'm overdue for my pneumonia shot. I've been on Tysabri for 13 years. Should I proceed with the shot or wait until things settle down regarding coronavirus? I thought that getting the shot might prevent pneumonia.
So pneumonia is serious, right? Influenza is serious. Those are infections that people are at risk of contracting. And this is separate from coronavirus. So I would talk to your healthcare provider, and if the best scenario is to take that shot to protect against pneumonia, that's a good idea. And that's actually separate and independent from coronavirus. We are internationally scurrying to try to develop a vaccine for coronavirus. Right now, we don't have one. But
Mm.
there are vaccines for certain types of pneumonia, and there are vaccines for the influenza, and there are vaccines for other viral infections like varicella. And so there are certain scenarios where it's appropriate to have those immunizations. I typically want my MS patients to have those immunizations, and that's important and separate from the whole coronavirus discussion.
And this is another thing that we've spoken about, but I'm going to highlight here again. If you have any questions or whatever, talk to your medical professional because they have your charts. They know your history. They know your ups and your downs and what you have, what your comorbidities are, and your risk in general over time. So
It's
we should be like, say again?
it's a team sport,
It's
and
team.
that team includes you at the center and includes your healthcare providers. And we're here to help you. And we have that information. We know your laboratories. We know your comorbid conditions. We can help you game out the right decision for you.
Yeah, this internet thing. This is certainly you have a medical professional and an MS professional here to make it happen for you and to answer any questions. However, in your specific case, the best thing for you to do is to call your doctor and your medical professional.
That's exactly
So
right.
if you
And
don't have that great a relationship with your doctor, your medical professional, now's a great time to figure out getting a new one.
And and it goes without saying that what we're doing right now is we're trying to educate. We're empowering, I hope. We're energizing, I hope. We're not providing medical recommendations. We're providing medical information so we can
Mhm.
up your game so that you can have an engaged and appropriate conversation with your medical professional. And
Absolutely.
let's do a couple other of these questions. These are good
Let's do
ones.
this. All right. So again, I'm a truck driver and I travel. I'm on Ocrevus. My last infusion was a couple weeks ago. What extra precautions should I be taking? Do I really have to be worried? If I do contract it, should I do anything extra since I had my last infusion a couple weeks ago?
So we talked about Ocrevus and we talked about how you get an infusion every 6 months. So if this person just had their Ocrevus a couple weeks ago, they are at slight increased risk of having a suppressed immune response compared to if they had gotten the shot 6 months ago or 5 months ago. So the best thing they can do, whether they're driving a truck or not, is these behavioral measures, avoiding large groups, not hanging out like, with 100 other people. If they're in their truck by themselves and they're, sanitizing the steering column and they're keeping their hands clean, those are great things to do. And being in a truck by yourself, you're not going to come in contact with virus. Again, the specifics for that individual must be discussed with their healthcare provider.
Mm, yeah, exactly. Pretty much. And it's another similar question. I'm scheduled to have my next infusion at the end of the month with the virus coming around. Would that be a good idea? Or should I skip this one? This sounds like, oh boy, you need to talk to your medical professional.
That's right, because there are situations with my patients where we've had that conversation and we've decided we're going to pull the trigger. We've had other conversations with my own patients where we've decided to wait a month. And
Mhm.
that was decided on a case by case basis with that individual knowing the specifics of their situation. And we want to
Mm.
make sure that we're applying the specifics of your situation for you when you are making that decision with your healthcare provider.
And here's another solid one. I've had MS for 6 years. What should patients that have had Lemtrada treatments be? What should they think about in regards to Corona after round one, after round two?
Yep.
I know we covered it here, but give the super short summation of this.
So the
This is a valid
super
concern.
short summation is that it has to do with how long ago you were treated and where your white counts are. Now, people that have received Lemtrada have a monthly blood draw. And so once a month, we have the information we need to tell them about their risk profile. And if they've had Lemtrada a year ago, 2 years ago, 3 years ago, and we're looking at those numbers, we can then game out whether they're at increased risk of having a severe infection or not. And so that information's at our fingertips, and they can work with their healthcare provider to say, yeah, you're at increased risk. Maybe you need to self-isolate. Maybe you need to take extra precautions, or you're not at risk because you've repopulated your immune response. Your absolute lymphocyte count is above zero point 0.8, and then you have the same risk to fight the infection as everybody else.
Yeah, and here's another one. Does having MS increase your chances to catch it, or worse, or have a worse course if you do contract the COVID-19?
The word is no. So
Yeah,
having MS in and of itself does not increase the risk to contract the virus. Having
yeah, great.
MS,
So
yeah, having MS
yeah,
yourself doesn't increase the risk of fighting the virus. It's the other comorbid conditions, the geography of where you live, your chronologic age, and the medicines you're taking that might alter that risk. Excellent
look,
questions.
somebody says I have MS and I'm pregnant and I'm currently on Tysabri. Will my baby be okay? Oh goodness, what about the children, Dr. Boston? Think of
So,
the children.
so obviously, this is a very complex real world situation. And obviously, we're going to need to talk to the provider about what's best for that individual. I think,
Yeah,
the measures that we've discussed, washing your hands, disinfecting surfaces, avoiding sick contacts, some degree of social isolation. These are all things we can do to flatten the curve, and these are all things we can do to keep that individual and their unborn child safe.
And I'm going to ask you to say that one more time because another question is I have MS and other health issues. So besides washing my hands and all that stuff, what can I do to not contract this? Dr. Bossa just said it, and he's going to say it again.
He is. Social isolation is an important community tool to prevent community spread of the virus, because if you're at home and nobody in your home has COVID-19, then you can't get COVID-19, right?
Now,
So if you avoid going to a large crowd where you're increasing your risk, then you have helped not just yourself, but other members of your community by not spreading that virus. Very, very helpful stuff that can make a really big difference.
and yeah, absolutely, absolutely. And these are all questions of super valid concerns because again, it's scary times, it's heady times, and your body is already attacking itself. So to have it have to now attack the bat flu that got in you, nah, man, that is not a good look. And somebody says, hey, is it true that if you have more than one autoimmune disease, that you're at bigger risk to get this disease? Comorbidities. That sounds like something we should talk to my healthcare professional about. But also, we're not at bigger risk, right?
That's exactly right. And the complexities of the real world are something that we have to grapple with each individual. It really depends on what the other autoimmune conditions are and what they're being used to be treated. For example, diabetes is an autoimmune disease which can create a suppressed immune response. And so if you have MS and diabetes, that may be of more concern about your ability to fight off an infection than if you didn't have those two conditions. But the take home is you need to talk to your provider, and I encourage people to abide by these very, very helpful behavioral tools to decrease their own risk of contracting the infection.
So if someone actually came in contact with COVID coronavirus and was tested after 3 days and that test was found to be negative, what should we do? Because isn't the incubation period for the virus 14 days?
Yep.
Can it still develop inside of you even though you've taken the test?
The answer is yes. Now, interestingly, here in the United States, there is a profound paucity of testing kits. And so it's really hard to get a hold of a testing kit. But let's take the hypothetical. The incubation period of this condition is between 2 and 14 days. And it's conceivable that you could have contracted the virus but not yet know it. I don't have a lot of experience with testing kits because I can't get a hold of any. And so we have to use some common sense. But keeping in mind that there's a period of about 2 weeks, that'll help us decide the time frame that we want to be observant and watch before we decide, hey, you're cool in the gang or not.
Yeah, no, this one here is like, hey, I have MS and I'm on Ocrevus. Should I go to the gym where there can be up to like 50 people at a time? Do I follow the CDC recommendation of hand washing? But I'm in public. I'm like, ooh, child, I ain't Dr. Boster, but I'm like, ooh, boo, boo, don't go to that gym when there's 50 people in there. Go there, in the morning
Right.
when there's like 10 and
Exactly.
make sure you wipe down everything.
That's exactly right. You just nailed it, Damien. You can still go to the gym. I'm not suggesting that you live like a hermit, locked in your house and board up your windows. Go to the gym, but go to the gym at 6 in the morning when there's nobody there, or go to the gym at 10 at night when there's not very many people there and wipe down the equipment. And so you can make decisions to continue to live a full life and get your fit on and exercise, but you can do it at a time that minimizes risk by minimizing the amount of people you come in contact with. That's exactly spot on.
And in that vein, hey, I had plans to travel in the next 2 weeks, staying in hotels, attending amusement parks, eating out. Is this something to reconsider and cancel plans?
Yes.
I would cancel my plans, girlfriend.
Yeah. So I think specifically the amusement park is a concern. Now, certain amusement parks around the country have shut down, and so I believe I saw something that Disney World had actually closed its doors. And the reason it's closing its doors is to be a shepherd of society. We don't want to get giant groups. I mean, if you've ever been to Disney World, there's thousands upon thousands of human beings
Everywhere.
standing well within, 6 feet of one another. And
Trying to
so
get on We Are the World and like the teacup ride. So
exactly
what is
right. And you're
this?
bumping into people and everybody's crowded. And so avoiding a crowded airplane when you don't need to be on the airplane and avoiding a Disney World when you could wait and do Disney or a cruise later is a really good idea. So in my opinion, now's not the time to take that trip.
I'm gonna give you some hood advice because I'm from Harlem, and if one thing that folks say in the hood is that you charge it to the game,
Yes.
and in
Yeah.
a lot of ways, like you write it off and like, oh, I'm out here in the game, and sometimes I spend a lot of money to do this one thing, but I can't do it anymore. Charge it to the game. So if
Yep.
you wanted to go to the amusement park and you've already put out a bunch of money, but you know that you could get really sick and in some cases even fatally sick, you charge that to the game. If you need to go see your Meemaw, but you need to get on a plane to go see Meemaw, one, you don't want to have the virus growing in you and then contract it to Meemaw because she will do much worse with it than
Yep.
yourself. And
Yep.
you don't want to be on an airplane with other people and other not air filtration systems. It's just a whole nother level of
So
risk. So you
you just
charge.
called me. Hey,
Yeah, no, you
Mima.
call me mom.
Hey,
Call
Mima,
me
how are
mom.
you
Be like,
doing?
look, I was trying to come and see you. I love you, but I had to charge your visit to the game, me mom.
And we can FaceTime Mima.
Yeah,
We
you can
could
FaceTime her.
we
Like
could talk.
that's it. Like if you are concerned about these things, don't do them. Just be like, hey, I flushed that money. Hey, I charged that money to the game. Hey, I'm gonna stay here, wash my hands, self-isolate, talk to my medical professional. I'm gonna do all of that. That's how we get through this.
Yep, that makes perfect sense.
Another question here. Again, this is like, yo, talk to your healthcare provider, man. My last infusion of Ocrevus was in last January. I'm a public health nurse, though. And in my very near future, my supervisor will be requesting me to obtain the swabs of possible COVID-19 suspects. Should I even be working, let alone obtaining specimens?
So this is a very real world situation where
Yeah.
this person has taken their Ocrevus, and one of the questions we're going to have to game out is, do we take the next infusion at the normal time or do we delay it? And is that line of work going to place that individual at increased risk, which it probably will. And so we're going to have to grapple with those specifics to decide what's right for that patient. That nurse might end up delaying her infusion or his infusion, or might need to seek a different way of collecting specimens. They may have everyone that's being tested wear a mask so that they're not coughing on that person. Obviously, we're going to use proper precautions with hand washing, etc.
All right, two more here, and then we're gonna get up out of here. It's in this social thing. Hey, how much should I avoid going to the clinic for doctor's appointments and physical therapy? Also, how much should I avoid going to social gatherings with friends? Thank you.
So those are two really good ones. And let's talk about going to the doctor. If you are going to the doctor for an elective evaluation, I think it's reasonable to call the doctor's office and say, do I need to come in? There are going to be situations where, yes, you need to come in. There's going to be other situations where this time we can do a phone call, or maybe this time we can do a video chat, or we can delay by a period of time. I also think you have to think about where you're going. So I have a standalone MS center, and there aren't a lot of people there. It's not a busy hospital with a busy hospital lobby. It's a much smaller standalone operation. Our infusion rooms are private rooms. All right, so each individual family's in their own space. They're not in a giant open forum with 50 chairs. Those are all important factors that we have to consider when placing a patient into the clinic or into the infusion center or into the hospital. These factors have to be considered. So if you have an upcoming doctor's appointment or dental appointment or elective procedure, it's reasonable to call the doctor's office and say, hey, are we still on? Do we still want to do this, or do we want to delay? And for example, if you are going to have an elective procedure, now might be the time that you delay that elective procedure.
Yeah.
If you can have that conversation with your healthcare provider, it's going to provide you with a sense of comfort and knowledge. This one is important. We do need to do it. This one is not important. We can wait. As far
Yeah,
as
no,
social gatherings, I think that we want to use very common sense. And if we don't need to be in a large group of people, we want to avoid that. We can,
yeah, no,
again,
this is like the last question here, and it's like a combination of the other questions. And again, I'm looking at these. There's pages and pages of these. One, thank you for submitting. Two, Dr. Boster has done a thorough job on hitting a lot of the complications and the questions that people would want, people would have when they have MS. So if I had not answered your question, just run yourself through the gauntlet of questions and the answers that Dr. Boster has provided. Because this person says that, ooh, that they're older. I missed that. Anyway, yeah, I'm on Ocrevus. I'm 45. Someone else is 65. They have comorbidities, high blood pressure, and other varying symptoms. Like this is, you know what I'm going to do right here? I'm just going to say, hey, Dr. Boster, tell us one more time the things that we can do to mitigate our risk and who is more at risk, because like age and stuff like that. Please, one more time, and then we'll wrap it up.
sounds good. And Damien, I'm going to pause because my dog's freaking out. So just give me a second.
Okay, we'll pause. We'll pause.
River Bear. River Bear. Come here.
That's my guy, River Bear. That's my guy right there.
All right, go lay down.
Hey, relax, bud. We're
All
trying
right.
to talk to the people, buddy. We're trying
All
to let
right.
them know right now.
Cue that up again one more time, just because there's a lot of barking
Yeah,
going
no,
on.
I'm just going to be like, hey, look, a lot of these questions overlap on what you've already touched on. Can you sum it up one more time from the top? And just know that, folks, ask yourself these questions and just know that these are the answers that Dr. Boster is providing. And if you still have questions, talk to your healthcare professional. They know your own case better or better than us. And they are on your team with you, ready to do the best thing for you.
That's exactly
So run
right.
us through this one more time, sir.
So let's from the top very briefly. Having MS in and of itself does not increase the risk to contract the virus or fight the virus. If you have advanced MS and have trouble breathing or swallowing, you're at increased risk of having trouble clearing the virus. Means that if you contract it, it might be harder to fight it off. Similarly, if you are over the age of 60 or under the age of 9, if you have comorbid medical conditions, or if you're on a medicine that lowers your white blood cell count, you would have a higher risk of having a severe infection or a tougher time in fighting the infection. There are many, many things that you can do, that I can do, to decrease the exposure to the virus. Because if we can limit the community transmission of the virus, we can flatten the curve and we can get through this more safely. Those things include washing your hands or using hand sanitizer after you cough, after you sneeze, after you use the bathroom, before you eat. Sneezing or coughing into a Kleenex, throwing the Kleenex out and then washing the hands. Making sure we wash hands with soap and water for 20 seconds, maybe saying happy birthday to make sure that we're washing long enough. Not touching your face too much, because the way that we think that we're contracting the virus is by getting it on our hands and then touching our face. Wiping down surfaces with disinfectant wipes, commonly touched surfaces, and when appropriate, applying social isolation, taking ourselves out of the mix so that we can't come in contact with the virus. These are all things that we can do actively to lower our risk of contracting the virus. And if you have questions, call your healthcare provider, holler at us, because we want to help you.
Yeah, no, that's huge. And my video on my own YouTube channel was a mashup of yours and someone else's because they had the most clear, direct information for me to put together and be like, well, I wish there was something more, you guys, but the people that I trust say this, and wash your hands. So respect and thank you for showing up today and being open and being open with your knowledge and your passion for folks with MS. Thank you, Doc.
It's my pleasure. You know, we are a community. This is a ever-growing global online community, and we are here to support each other. When I write hashtag stronger together, I mean it. And even if we are all in our individual houses, we have these interwebs to connect us. And that is a powerful, powerful tool. I want people that are watching this to know that you're not alone, all right? You're not doing this by yourself, and that we are here as a community to support you, and we love you. My name's Aaron Boster, and I want to thank you as always for learning about MS with me. Damien, MS Views News, I want to thank you for this opportunity. And until the next time that I do a live stream, or I see you on a video, or the next time I see you in clinic, this is Aaron Boster saying be safe and take care.
Thanks for being with us, Dr. Boster. Thanks for giving us your knowledge. Bye. Go to msviewsandnews.org for more multiple sclerosis information.